And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We are talking about things plastic surgery, and any advice we give you today, consult your own physician, of course. And welcome back, Dr. Mele.
Thank you.
Up next, let me see if I can say it.
You can do it.
Augmentation Mastopexy.
Perfect.
Pretty good.
Yeah.
All right, then what is it?
So augmentation, again, is enlargement, like facial augmentation. But mastopexy has to do with the breast and has to do with breast lifts.
Oh, okay.
So it's a breast augmentation where we're also doing a lift.
So are you putting the implant, so you're putting an implant in and a lift?
Both.
Oh, I gotcha. Who's a good candidate for that? Is it a mommy makeover type of thing, or what's going on?
Often. Usually when we're doing a lift, it's usually after weight loss or children. Because the breasts get larger and then they lose volume and drop. And often we don't want to replace all the volume that was there during lactation. So we're putting in a smaller implant than was originally stretching out the skin. So we still need to do a little lift in order to make it match.
Just kind of make everything.
Yeah, so the lift kind of makes it pretty, changes the shape, whereas the implant adds volume and restores the size.
How do you know, how do you know if they need an implant or they just need a lift?
It's a great question.
Thank you.
A lot of it has to do with the position of the nipple. So if the nipple is very, very low, and we put an implant in, the nipple is still going to be low, and it may even push the nipple lower if it's on the lower part of the breast. Yeah, that's the reaction I would get if I left it that way. So we lift the nipple into a higher position. The other time that we're doing lifts is when the breast mound itself is low. And that's what they call like the pencil test. So if you can hold up a pencil, it means some of the breast is down below the inframalleolus.
If you can hold a pencil under the fold of your breast and it stays, that
means that there's some overhang.
You need a little lift.
Now that's normal. A small amount doesn't always bother people. But if it's a significant amount, especially if most of the breast tissue is below that fold, then a lift will enhance the size and the shape.
So lift, I know that the original way to do a lift is a T-scar type of thing. Is that still the norm? Are there different ways to do that? How does that work?
It's still kind of our workhorse. When all else fails, that's what gives us the lift we need. So in situations where we're doing breast reductions, most of the time we're doing an inverted T-lift. There are ways to do it with vertical lifts also, but I find the vertical scar isn't what bothers people, or is what bothers people. So the horizontal scar that we use for the inverted T, it's hidden in the fold. So if it makes things look better, it's easier to do, it just makes sense to utilize that. And in cases with severe ptosis, a lot of sagging, sometimes I can eliminate the vertical scar and only have the horizontal one. And that makes people very happy. Because women don't like to see that scar in the front of the breast. There's still one around the nipple. And the one underneath, but not that vertical scar. It seems to make a huge difference.
It does. And so how long does it take the vertical scar to go away? Or is that,
Sure, well, there's always a scar there. But we expect it to fade and get better, and it takes about a year for it to be fully mature.
All right, let's talk about some pictures. Take a look at number one here. Get an idea. Okay, what's going on?
So this is someone who came in with kind of the flattened, pancaked out breast. Could not pass the pencil test. The nipple itself is below that fold. So what I've done is a lift with augmentation, and because we're putting an implant, we're adding more support with the implant. I don't need to do as big a lift. So sometimes I can get away with just doing a periareolar lift or just the vertical lift, not having to do that scar underneath.
The whatever.
Periareolar means around that pigmented skin around the nipple.
Oh, okay. Well, just in case nobody knew that.
It's like we have different words for everything.
Just want to make sure. Okay, so that's good. And you know what I like about that? It's very natural looking.
And it's a good size.
It is a good size.
And in order to try and fill all of that skin out with an implant, it would be twice the size, and it would be low. And we like it the right size in the right place.
Probably.
Yeah, it looks overdone.
Overdone. This is number two. What's going on?
Number two. So here's someone with loss of volume in the upper pole. The upper part of the breast is kind of flattened out, so we're using the implant to restore that. The implant's placed behind the muscle in this case, so we get a nice tapered shape on the top. Underneath, we get the nice round curve, which is what we want.
And you did a lift on that one?
So I did a lift on this woman also, because the nipple is kind of pointing downwards.
Oh, right.
And she's a little tubular. The breast was a little bit tubular in shape. One of the problems that can happen with a periareolar alone lift is it tends to flatten the breast. But when the breast is a little tubular, you kind of want to flatten it a little bit. So it enhances the result.
And then number three, and you know what I noticed? On all your pictures, there's really not a lot of scarring. I don't really see that vertical scar.
It's hard to see the scars
underneath.
To see the scar. But sometimes you can. Sometimes they're red, sometimes they're brown. It's about 1% of the time we get a scar we're really not happy with. We might have to revise it. But I try to encourage my patients to do massage afterwards, use silicone, a little silicone sheeting or gel. That can help the scar too. And just massaging it
Helps
even
the
just
scar a lot?
using Vaseline, massaging the scar,
Oh, really?
that little bit of moisturizer really helps.
And it's soft. Do you have to do that to soften the implants as well, or has it gotten better to where you don't have to do that?
I believe it helps
Okay.
if it's a smooth implant.
Yeah.
Textured implants, probably not so much.
Okay, good. And when you do an augmentation and a lift, what's the recovery time for that? Because a lot of people, you know, they need that mommy makeover, but am I going to take all this time off work? So what's the deal?
Or away from the kids.
Or away from the kids, exactly.
Not being able to pick up your 2-year-old is
Absolutely.
a little bit of a hindrance.
Yeah.
Usually it's a week or two.
Okay.
If they're doing really full contact sports, about 6 weeks before you really want to do anything where you're going to get a blow there.
Okay.
It's probably not a good idea to get hit in the breast
No,
anytime,
ow.
but especially not after surgery.
Okay, good.
But I think about a week or
All right,
two,
that's not bad.
the recovery is the same as an
Yeah.
augmentation. The lift doesn't really seem to add to the recovery time.
All right, for more information about Dr. Mele, you can call 925-943-6353. Check them out on the web, drmele.com or sanfranciscobreast.com. Lots more coming up. We've got all kinds of topics to talk about, so stay right there on Body Beautiful.